Hello and welcome back to Dr. Ryder Shows Us Stuff. Today we are looking at the scapula. We are starting on the posterior view. So if you notice here, the posterior view has this large ridge that runs from medial to lateral. That is the spinous process of the scapula. So just like you, the spine of the scapula is on its posterior side, and your spine is on your posterior side as well. So this is the spine of the scapula. If you go to the lateral edge of the spine of the scapula, you have this here. This is the acromion process. If you're just inferior to the acromion process, you'll have this rounded section here that's kind of concave. This is the glenoid fossa or the glenoid cavity. It always marks the lateral side of the bone. So this here would be the lateral border of the scapula, which makes this over here the medial border. If you notice down here, we have this sharp kind of angle. This would be the inferior angle. We also have one up here. This is the superior angle. We're going to go back to the spine of the scapula, and you'll notice there are two kind of little divots or fossa, if you will. The one above the scapula, here where the probe is resting, is the supraspinatus fossa. The one below the spine of the scapula is the infraspinatus fossa. So let's go through some of these again here. We have the spinous process, the acromion process, the glenoid cavity or fossa, the lateral border, the medial border, the inferior angle, the superior angle. This area here would be the supraspinatus fossa and the infraspinatus fossa. Now we're going to flip this scapula to the anterior view. We're going to start on the superior angle here, and we're going to run laterally downhill until we get to this little notch. This is the scapular notch, or sometimes referred to as the suprascapular notch. Right? Here, this part that sticks out is the coracoid process. And if you notice, the surface of the scapula here is kind of concave. This is the subscapular fossa. And that concludes the scapula.